Imagine struggling to catch your breath. Each breath feels like it could be your last, like you're gasping through a straw. That's the reality for millions living with COPD. The sudden flare-ups, or exacerbations, of COPD are terrifying, dangerous, and can throw life completely off track. With over 16 million people affected in the United States alone, COPD is one of the most common chronic diseases. These flare-ups aren't just minor setbacks, they can lead to serious, sometimes life-threatening complications. If you or someone you know has COPD, it's crucial to understand these exacerbations, why they happen, and how to prevent them. 1. Understanding COPD and exacerbations. First, let's break down what COPD is and why exacerbations are a big deal. COPD, or chronic obstructive pulmonary disease, is an umbrella term for a group of lung diseases that block airflow and make it difficult to breathe. COPD doesn't just make life harder, it can progressively worsen over time. An acute exacerbation of COPD is when the condition suddenly worsens, usually over several days, and breathing becomes much more difficult. These episodes are serious. People with COPD who experience an exacerbation may have long-lasting effects, like a decline in quality of life or reduced lung function. COPD exacerbations are a major reason why people with this disease end up in the hospital, sometimes repeatedly, because flare-ups can happen more than once. 2. Symptoms of an exacerbation. Know the signs. It's important to recognize the symptoms of an acute exacerbation so you can act quickly. Symptoms can differ from person to person, and even vary between different episodes, but here are some common signs. Increased breathlessness. You might feel like it's harder to breathe than usual. Coughing more frequently. Sometimes it's a dry cough, other times, there's more mucus involved. Changing sputum. This means more mucus, or a change in its color, often from clear to yellow, green, or even brown. Fatigue. It may feel like you're too tired to do much at all. Difficulty sleeping. Waking up suddenly or feeling out of breath even when resting. Headaches and confusion. Lower oxygen levels can make you feel groggy or disoriented. Fever. Although not as common, fever can indicate an infection that may be triggering the exacerbation. If you have COPD and experience any sudden worsening of these symptoms, it's time to seek medical attention right away. Early diagnosis and treatment can make a significant difference. 3. Why exacerbations happen. So, what causes these exacerbations? For many, infections are the main culprit. Viral infections like the cold or flu, and sometimes bacterial infections, can lead to sudden flare-ups. Other common causes include allergens and irritants. Pollen, dust, and even strong smells like perfumes or chemical fumes can set off symptoms. Air pollution. Smoke and pollution in the air can trigger exacerbations, especially in urban areas. Weather changes. Some people with COPD notice that weather changes, like sudden cold snaps, can make breathing harder. 4. Who's most at risk? Anyone with COPD can experience an exacerbation, but some factors increase the risk. Smoking. If you smoke, you're at a higher risk. It's that simple. Severity of COPD. People with more advanced COPD are more likely to have these episodes. Not taking medications as prescribed. Skipping doses or not taking your medications correctly can increase your chances of an exacerbation. The fact is, COPD is a progressive disease, which means it gets worse over time. This means that every exacerbation can bring you one step closer to permanent lung damage. It's a scary thought, but it's why prevention and management are so important. 5. Preventing exacerbations. Steps you can take. Prevention is key. While you can't always avoid an exacerbation, there are steps you can take to reduce your risk. Get vaccinated. Annual flu shots and pneumococcal vaccines can significantly reduce your risk of respiratory infections. Avoid sick people. Try to steer clear of anyone with cold or flu symptoms, as infections are a top trigger for exacerbations. Identify and avoid triggers. Stay away from smoke, dust, pollution, and any specific triggers that worsen your symptoms. Follow your medication plan. Taking medications as prescribed can help keep symptoms under control. Quit smoking. If you're a smoker, quitting is one of the best things you can do for your lungs. It's not easy, but it's worth it. Stay active and eat well. Exercise and a balanced diet strengthen your body, which can help you manage COPD better. If you have COPD, consider having an action plan, a written set of instructions detailing what to do if your symptoms worsen. Having a plan can help you act quickly and stay calm during an exacerbation. 6. Treatment options for exacerbations. Treatment for an exacerbation typically involves managing symptoms and preventing complications. Here's a look at some common treatments. Inhaled bronchodilators. These medications help open the airways, making it easier to breathe. Steroids, often prescribed to reduce airway inflammation. Antibiotics. If a bacterial infection is present, antibiotics can help clear it up. Supplemental oxygen therapy. Some people may need extra oxygen, which they can get from an oxygen tank or nasal cannula. In severe cases, hospitalization might be necessary. This allows healthcare providers to monitor symptoms closely and provide intensive treatment if needed. In rare cases, doctors might recommend surgery. Options include procedures to remove damaged lung tissue, which can sometimes improve breathing. 7. Living with COPD. Managing for the long term. While COPD has no cure, managing it with a treatment plan and regular checkups can slow the disease's progression and improve quality of life. The key is consistency. By sticking with a routine and making healthy lifestyle choices, many people find that they're able to control their symptoms effectively. Recap: acute exacerbations of COPD are not just inconvenient, they're serious and can be life-threatening. With awareness and preventive measures, however, it's possible to reduce the frequency and severity of these flare-ups. Recognize the symptoms, understand your triggers, and stay on top of your medications and treatment plan. COPD may not be curable, but it's definitely manageable. Closing thoughts: remember, if you or someone you care about has COPD, every little step you take towards managing the disease can make a big difference. From vaccinations to staying active, the actions you take today can help you breathe a little easier tomorrow. COPD is challenging, but by arming yourself with knowledge and being proactive, you can tackle those exacerbations head-on and take back control.